Greetings, everyone. I'm Dr. Shruti Desai, one of the fellows in rheumatology. We all know that rheumatology is a specialty which deals with chronic conditions, which means that it is a lifelong condition. And some patients actually face complications. They'll have a lot of ups and downs and challenges, be it related to the disease itself or related to the treatment. So these can lead to patient to have a feeling of frustrations, feeling of loneliness, or even the low mood. And sometimes even the family don't understand what is going on, and this can cause a lot of psychological issues in them. So with this in mind, and to help the patients overcome these challenges, we would like to introduce you to a concept called specific disease group meet. And to discuss about these group meets or group sessions, what we call, we have Dr. Chandrasekhara with us, who is a consultant rheumatologist, and Dr. Rajeshwari, our clinical psychologist. Sir, I would like to ask or brief our patients about what is this group meet or group session?
Yeah. See, group meet or group session or a disease-specific group session is a sort of assembly or meeting of the people suffering from similar issues. Say, for example, if it is rheumatoid arthritis, it's a meeting of the people who are suffering from rheumatoid arthritis. I would like not to call it as patients suffering from rheumatoid arthritis. I would like to insist, I would like it to be called as people suffering from rheumatoid arthritis. Why we should have a group meet and what is the purpose of a disease-specific group meet? See, it's always we feel light-hearted after sharing our trouble with someone. So if we share the problems, we always often say that our heart is little lightened up. So now question comes is, with whom should I share? And with who is the best person to share? And how to work with the disease? There are a lot of issues that will be there. And also each one of us are unique and we have our own experiences in life. And that also shapes us up how we face each of the problems. So that being the case, when a group of us or a group of people suffering from similar problems sit across and freely talk across that how he or she is having a trouble with the disease, how he or she is facing that disease with fear or with the confidence or with the courage. See, you can have all the three. One can have a fear of the disease, one can have a courage to face the disease, or one might have slowly just got passively adopted to the disease. So there are varieties of way each one of us would have adopted to these problems. Sharing this experience in a single platform, when we share our problems and experience among each other, we learn each other that how another person worked with his problems and can I use it for my benefit? And he can share his, how did he work with the problems. Sharing this particular experience will help us, number one, to face the disease. And second thing, as Dr. Shruti was introducing, loneliness becomes an issue. Each of us will always think that, is this problem has come only on me? I am the only cursed fellow to have these problems. But once we see it's not just me, you have another 10 people along with you, it brings our heart a little lighter. It's not the correct way to, but that's how we live with the disease and that's how we live. So if there is one another person have a similar problem, we feel that, oh, okay, there is a partner for me with this particular problem. So basically with an intention to share these kind of ideas, concepts, and perceptions, we thought it's always nice to have a group meeting of the people who suffer from similar diseases. So that was the objective with which this particular group meeting are organized. It is done across the globe. Everyone, either the voluntary organization does it, and in India, we have less number of such voluntary organizations. That's why we thought we as a specialty center, if we take the things forward, these people can sit across, spend some 1 hour or 1.5 hours or whatever the time, and each exchange each other their problems, ideas, and concepts so that it lightens the heart across them. So that's what we call it as a disease-specific group therapy. We would like not to mix up with the different disease, basically because we may get mixed up. Suppose if a patient, just for a simple example, a patient who has a diabetes shares his concern with the patient who is having hypertension, see, there will be a confusion because Diabetes patients say, I will avoid the sugar, but the hypertension patient need not avoid the sugar. So there is a confusion. So to avoid this confusion, we always would like to have the patients who have a similar illness or a similar problem to sit across and talk to each other. So that's why we use a word disease-specific group discussion or a group meeting.
Dr. Rajeshwari, so you deal with psychological aspects of these chronic conditions. So how do you think these group therapies or group sessions are going to benefit our patients?
Yeah, so as the name suggests, it is specific disease group meeting. So as Dr. Chandrasekhar sir has explained very clearly, the people who are involved at the group which we see are belonging to one particular chronic disease. So one thing, when they meet similar kind of people, their self-esteem is increased. So I would like to give a small example. Recently, one of my friend had visited the hospital, and when she was leaving, the one thing which we shared was that after coming here, I got to know that there are so many other people who are suffering the same issues, and they are managing that. Now there are so many even with the severity, they are managing that. So that is what the group impacts you. So what happens usually when we go for one-on-one session as a therapist, for us, it is a little tricky to convince the patient, saying that, along with medication, there are other certain strategies that will help you, or that will help your mental health. So along with your physical health, mental health should also be addressed, where the patients fail to understand. So in group session, we as a therapist are the channels for the patients to explore themselves. So they pay more than us. They are the one who are sharing the experience. They are the one who are talking among themselves. So they'll get to know with certain techniques they can overcome the hurdles, or they can make their journey along with this chronic illness in a better way. So the self-esteem is boosted here, and one of the important thing is management. So once you're diagnosed with chronic illness, how to manage the diagnosis or how to manage that disease is very important. So many patients fail to understand, like, how to manage, what are the medications has to be taken, why the medication is prolonged, or what are the psychological effects that will cause along with the chronic illness. So these minute things, or the managing the disease, will be addressed, and when they speak among themselves, they get to know some of the better ways to manage. So one technique may benefit one person and one may not benefit the other. So they'll discuss among themselves how exactly that can be carried out, and what are the benefits it will do it in a long run. And few people start isolating themselves once they are diagnosed with certain chronic illness. They isolate themselves. They don't want to socialize with outside people, or they avoid gatherings and all. So here they'll realize that there is no need to isolate, so that normalizations will be there, and the people think that there is no barrier for them. So this is how it can be benefited.
So Dr. Chandrasekhar, so if the group meeting involves bringing all the people together with the specific disease, how important is the specialist to guide the session?
Yeah, see, the professional or a specialist involvement in this group of discussion is more often passive and more like a guide. So what it means is, see, for instance, sometime there will be a problem which the perception of a patient may not be correct, which may have to give a wrong message moved across. So at that particular point of time, usually the professional intervene to help them, and so that they guide the thinking process or a discussion process. So it's more like what I say is, when we let the children to play, it's always best one of the PT master or one of the teacher be at that place. The reason is, see, it's after certain points, the children may be playing, but there could be an error of play. The rule of game may be lost. That's what we call as, when there is a rule of game is lost, you need someone to monitor and someone to streamline the discussions and processes. So that is where a professionals being involved becomes a necessity. Professional is not the person who is going to sit and lead your discussions, is not the person who is going to say what to discuss, is not the one who is going to talk. He is expected to talk less. And the professionals will be just sitting and passively looking at what is happening, what's going on. See, for example, just to give an example, say some patient feels that, to say that, no, I feel so dejected, I feel like killing myself, and I have made a lot of attempt to kill myself. So this is some sort of a sheer desperation by a patient. At that time, usually we expect a professional, especially either a psychologist or a rheumatologist or someone who knows about it, to address how one can prevent this kind of depression thoughts. And then leave it to another participants to discuss about how was she or he overcomes each time when he thinks like that, how his family supports it, and how he can extend to get the support from a professional or others. See that what I'm trying to say is, so he becomes a necessary as a teacher in a playground. And it's a playground, you don't expect a teacher to play have a major role as a captain. He's not a captain. There will be a captain of the team of each of the players of the children or whoever is playing. But he will be guiding how to go about it. And that's where a role of professional comes. And the professional role will help them to have a very streamlined and a fruitful discussion among themselves, so that the soreness of the discussions or a bitterness in the discussion or things going wrong in the direction, discussions can be streamlined for a better outcome. So that's why we always insist a professional to be a part of these group discussions, so that things are much better and made them to understand the issues relatable to the disease or even out of the disease, which may need some amount of professional help.
Dr. Rajeshwari, how frequent these meetings are usually held, and what is expected from the patients?
Yeah, so again, the group meeting, how many times you have to come for the group, it depends individually. Some people may get benefited in one session or the one group meeting, whereas some people may need 2 to 3 sessions for that. So, and again, there will be some people who would say that they need some individual session, because there are certain things which patients may not be comfortable enough to, discuss in the group. So maybe after the group sessions, they're always welcome to, talk to a therapist in an individual manner. So that is one thing. And what we as a therapist accept from the patients, one thing is confidentiality. So whatever discussed in the group will remain in that group. You're not supposed to, go out and discuss these are the things happen, or these are the issues we have discussed. So what happens, there might be some patient who, after a point of time, after getting comfortable with the group session, they may share some of the sensitive things which they think will be maintained in a confidential way. But when they get to know that confidentiality has broken, in a way we are breaking their trust. So that confidentiality will be maintained in that group sessions.
Dr. Chandrasekhar, so yeah, this group meet does sound very good for the patients, but we all know that their accessibility or the facility are less than India. So how do we make this more accessible for the patients?
Yeah, no, we had a thought process to start these group meetings 2 to 3 years back, and unfortunately COVID became a major issue for us to put anybody together. With the waning off of the pandemic, I think we have proposed to start it in a few days. And we are looking at a frequency of at least 1 session or 2 sessions in a week, which are disease specific, because we are focusing to initially with 4 or 5 diseases. And slowly we may have once in a while about a relatively rare diseases, less common diseases, where we may have only 1 or 2, 3 patients per annum. So based on the intensity or the frequency of diseases, we are looking at having 2 sessions or 1 sessions in a week time. So those facilities we are organizing in our center. And I think I request all our patients, even the patients who are not otherwise being seen in our center, to join in these group meetings, and they can discuss freely to take up their life journey much more smoother, with whatever the trouble that is there in the back of the mind, which can be lightened up and can have a fruitful, very good quality of life. Because end of the day, What matters for is a good quality of life. I think for that, we are looking at in creating these facilities for the benefit of the patients. I hope they make use of these facilities in long time to come.
So with that in mind, just could it be started online as well?
Online, we can create those sessions, but the problem in online is it's not like a personal face-to-face communications. We can try that out, actually, as we have suggested. We can try once or twice on these areas of online consultation or online discussions too. It may also help people to blank themselves. I mean, in a sense, he doesn't want to have his identity being revealed. He can always keep the video off and can still discuss. There is one big advantage in that. But the biggest disadvantage is we are humans and we are social beings. And we love sitting across and talking to each other. And we know, I mean, as a human, sometimes we call over the phone just to say, come and visit me. I mean, so we know that I would have completed the whole communication on the phone. We still don't like it. We just say that, come and see me, I'm waiting for you. I mean, see, that's how things are. So we thought the personal communications are much more advantageous and much more touching than the online. Probably, I think we can also have an online meet. We did have one or two of such online group meetings. Of course, the results, I'm not very sure. We did evaluate whether it really worked better. We can try that too. Yeah, if it works, that would also be one another mode we would like to encourage them.
Thank you, both of you. We really hope that this session was useful, and we hope that our patients do get benefit from this. Thank you.